Did you know that the corn dough or cassava dough you buy from the market could be exposing you to harmful pathogens? Well, the reason? The very individuals responsible for grinding these staple foods are operating in deeply unsanitary conditions. The latest visit by the Joy Clean Ghana campaign to Accra's Central Business District has uncovered alarming hygiene breaches at several milling centers, conditions that pose serious health risk. My colleague Stephen Mensah has more.
And you can see the miller. He's not wearing any apron, protective gear. He is bare-chested. He is sweating. The sweat will even enter the condo. And this is the condo that people will come and buy and go and prepare food. Banku, all the chobas and whatever. This is their source of what? Raw material. And look at the environment. Look at this place where they store the maize in a dirty environment.
Swali. Papa in the animal. Tankan is by Babe Samao.
If you are living, let me. So, Swali then. So look at the floor. The floor of a mill should be clean and hygienic. But this floor is not clean. Even at the close of day, they do not clean the place. You can see accumulation of what waste over there. And these are what detrimental articles that are not supposed to be here, dresses and whatever. These are some of the dresses. It's not supposed to be at the corn mill.
What is supposed to be here?
Nothing should be here.
But then, just as I mentioned earlier, these are some things that play out in almost all these milling stations.
So by our standard, by AMA bylaws, we shouldn't have dressing, we shouldn't hang clothes in a corn mill, according to the bylaws.
And what health risks do these things pose to you and I?
Now, if the dress is dirty, you can imagine, it can contaminate the food products here. Are you getting it? The floor, look at the floor is dirty. The floor has not been. When they are cleaning, they just shift the waste in the corner there. And he himself, he's not wearing any apron. He is sweating. The sweat will enter the food.
I see. You don't have a problem with the processor itself.
No, there's no problem here. But he himself and the environment should be clean. Look at this place.
So you're not concerned about the environment?
The environment, even the machine should be clean, but the machine doesn't have any problem.
Right, let's bring in a food scientist, Dr. Ekpe Anyima Aka. He is a lecturer at the Faculty of Health, Allied Sciences and Home Economics Education at the University of Education, Winneba. Grateful for your time this afternoon. If you look at those unsanitary conditions there, what does that tell you? We're still trying to connect the phone lines with Dr. Aka there, who is a food scientist. And what you're seeing on your screen is the unsanitary milling centers in Accra, which is raising public health concerns. You're seeing some condos and other stuff that are ready to be mailed there. And the health inspectors went to the place, were clearly unhappy with what they saw, and they say they have sanctioned the corn miller there. That's the shirtless man who is milling the corn and other, food stuff that will be sent to our markets, will be ready on our plates for consumption. Dr. Aka, welcome to the program. As a food scientist, does it come to you as a surprise that a corn dough or cassava dough that people buy from the market could be exposing them to harmful pathogens? You've been seeing on your screen how indiscriminately it is being kept.
Thank you very much for having me. Can you hear me?
I can, loud and clear.
Okay, great. So this is very crucial because I want to thank JoyNews for uncovering this, or at least highlighting it to the public or stakeholders to take effective action on this. It is not surprising. It has been going on and consumers alike have taken it for granted. But the serious...
The Pulse returns shortly after this break.
Protective gear.
The latest visit by the Joy Clean Ghana campaign to Accra's Central Business District has uncovered alarming hygiene breaches at several milling centers, conditions that pose serious public health risk, as you can see on your screen. And let's speak to food scientist Dr. Ekpo Anyima Aka. He's a lecturer at the Faculty of Health, Allied Sciences and Home Economics Education at the University of Education, Winneba. Thank you very much for your time. What do you make of those unsanitary conditions? And as you are aware, it's lunchtime, and many of us may be enjoying a bowl of fufu, konkonte, or mutu, or tiozafi with well-prepared goat meat in Katinkwan or Abenkwan at chop bars, bush canteens, and other eateries across the country. But there's a growing concern about the future supply for goat meat. The ECOWAS Regional Animal Health Center says about 157 million goats and 110 million sheep across West Africa, including Ghana, are at risk from a highly contagious viral disease in the West African sub-region. And as authorities say, the disease will require a massive vaccination campaign across the region. The following report has more.
Your favorite goat or sheep meat served with fufu, kokonte, omuto, and other popular delicacies in Ghana could soon come under pressure. ECOWAS is raising concern about the outbreak and spread of peste de petit ruminant, a highly contagious viral disease popularly known as goat or sheep plague. The regional body says more than 150 million goats and 110 million sheep across Ghana and other West African countries are at risk, with fatality rates among infected animals reaching as high as 90%. Simon Kihu is a representative of World Organization of Animal Health at ECOWAS.
We need to confront peste de petit ruminant, a disease that may be invisible to the global headlines, yet it's very visible and devastating in our rural communities. PPL silently erodes food security, income, and resilience. In the Sahel and the coastal zones, small ruminants are primary entry point for the livestock economy, to the livestock economy. The EU-funded Pan-African PPL eradication program, coordinated by AU-AIBA, implemented by OA, AU PANVAC, and FAO, represents a transformative partnership with the significant resources already mobilized and substantial second phase envisaged. This initiative addresses critical gaps in epidemiological intelligence, vaccination coverage, regional coordination. It enables us to identify viral reservoirs, map transmission corridors, analyze cross-border livestock movements that sustain viral presence. In essence, what we call PPL ecosystems. Veterinary professionals have been trained and digital tools have introduced to enable real-time monitoring of campaigns. To date, hundreds of millions of animals have been vaccinated across the participating countries.
The good news is that the disease is not zoonotic, meaning it cannot be transmitted to humans. However, experts at ECOWAS are warning it could severely disrupt livestock supply across the region, potentially driving up the price of goat meat and threatening farmers' incomes. They say a coordinated mass vaccination campaign is now being rolled out across West Africa to contain the spread of the disease and protect livestock populations. Dr. Emmanuel Kujo is Ghana's Chief Veterinary Officer.
Livestock production remains a cornerstone of economic stability and rural development within ECOWAS member states. Mass vaccination campaigns are among the most effective tools we have to control and, where feasible, eradicate priority transboundary animal diseases. This workshop is therefore both timely and strategic.
Mavis Kabukwas reports for JoyNews.
Well, let's try Dr. Enyima Aka once again for more on this. Doc, I was asking you about the unsanitary ways in which corn meals and other foodstuff are prepared for people to eat. When you looked at that particular campaign by JoyNews, where even the place that those things are milled are very, very dirty, what do you make of it?
Thank you very much. Please, can you hear me?
I can.
Thank you very much, and thank you for the opportunity. I want to commend Joy for this campaign, for highlighting this and bringing this sensitive issue to public awareness, because it has enormous public health implications. The first is that, look, especially for vulnerable children, babies who take ready-to-eat foods that are prepared from some of these milled products, pregnant women who eat, and even elderly people who take pepper and other spices that have been milled through these mills and put them directly into their food. It is a dangerous and a critical public health menace.
And banku, other foodstuff, are the favorite of many Ghanaians. What diseases can people contract if they consume such food, looking at the situations in which they are prepared?
Thank you very much. You see, before I answer this question, let me talk about the pathways. First of all, two critical pathways. There are others, but the first and most important is spore-mediated contamination. If food products, the mills serve as a point where they aggregate a lot of these pathogens and distribute them en masse, because various sources of food are brought there and various sources of food are produced out of the milled product. And so they are able to persist. If you treat them very well, you will be able to remove some of these pathogens, okay? You kill the pathogens, but the critical ones are the spores that stays inside the food product. And the second is the toxins, which cannot be removed mostly by heat. So these two are the very important critical points that have to be managed. So we have salmonella-related diseases. That is, to answer your question directly, salmonella-related diseases.
Right.
Bacillus, serious-related diseases. We also have others as well. And these are generally non-typhoid related diseases. Then we have the diarrheal diseases. But the hidden one, which is mostly ignored, is the chronic diseases that occur. You see, for infants, the acute exposure to some of these toxicants and pathogens can create acute diarrhea and other foodborne related diseases. But in the long term, some of these toxins, if allowed, can create chronic diseases. For example, aflatoxin and related toxins can persist in the food even after being treated and are associated with carcinoma.
Right. Dr. Enyima Aka is a food scientist. Thank you very much for your time this evening.